at the beginning.
Oh, no, I was waiting
Oh,
to.
good. Good job,
You
Katie.
just started.
Okay, well, I will do an official introduction. Um, so well, first of all, so healthcare sector meeting, and we've got people from all over, just so you know, Haley, we've got people from all over the city really involved in this. So we got like KU Med, UMKC, Kansas City University. We have the like invited people from all over the city, honestly, but we those are kind of the primary folks who come to these, at least in the healthcare sector meeting. But we've got many other sectors, and I think honestly, Fit Truck could probably be shown to several of the sectors, and they'd be interested in it. But I think the healthcare sector is kind of the place to start. But for everyone who's on the meeting today, and for everyone who's going to be watching this later, I'd like to introduce Haley Bland Walsh, and she's the owner, co-owner, I guess, right? Co-owner of
Yeah,
Fit Truck?
co-founder of Fit
Yeah.
Truck. Mhm.
Co-founder of Fit Truck, and you also do City Gym, is that correct?
Yes, I'm the co-owner, co-founder of Fit Truck. I'm the owner and founder of City Gym. I've worked in the fitness industry for over 20 years. So I, like you all, consider myself to be on the side of the prevention side of healthcare. So I think this application is exactly what you all have been talking about for a long time. So I'm very excited to have the opportunity to chat with you about applications and brainstorm or answer any questions you might have. It's one of those ideas that when you see it, you'll walk away and you'll start to marinate on it, and you're going to think, oh, you'll think of it 2 or 3 applications today, and by tomorrow you'll have 2 or 3 more, and it just kind of grows exponentially.
Cool. Well, I think Katie, if you can give Haley control, I think she's got a video and stuff to show us as well. But yeah, go ahead and let us know about Fit Truck.
Cool. Yeah, it looks, Katie, like I have the ability to share, so I'll just do that.
Yeah, I was gonna say you should already have the option to.
Cool. Do this. Shit. Did I go out of it? No, I'm still here. Here we go. It was sent to me in a Google Doc, so let me see. I think this is going to be the best.
And I think while you're getting that, I think probably the best application for this for us is when as we expand the exercises medicine stuff throughout the city, and kind of hopefully establish that with some of the guidance we're getting from University of South Carolina, Greenville, and hopefully in all the hospitals in the city. But this is a way to get to some people who don't have access, especially. So awesome. Here's the video.
Yeah, and just to say, so I worked for the YMCA for 8 years in the San Francisco Bay Area. So from a public health standpoint and from a public health impact, I ran a lot of programs where the folks who came in were doing some sort of disease prevention or delay or application. So whether it was breast cancer or type 2 diabetes or obesity. And so we were dealing with these special populations. And what I found always was that the people who needed us most were the folks who were least likely to walk through the door. So I'm sitting in these big, beautiful facilities that cost millions and millions of dollars to run and to operate. And the folks who needed us most either felt too intimidated, too overwhelmed, or they just felt like even the YMCA was not the place for them. So the YMCA, the sort of the bastion for we welcome everyone, it felt like the folks who needed us most weren't there. So as we were conceptualizing Fit Truck, I have always had the vision that this would be an application for folks who were trying to do some sort of like public health medical intervention because of its accessibility. And not just in terms of how accessible it is on the truck. And I'm going to show you a video which will give you the opportunity to see who can use it and how it can be used. But there is something you know, I've been doing this for 20 years. I'm a personal trainer, fitness instructor. I own a gym, have worked in gyms and managed gyms all over the country. And there is something that happens when you drive into a community and build some rapport in a local community that does not happen inside of a brick and mortar facility. It just doesn't. I knew it, but to watch it in application with FitTruck and the way folks who would never come to City Gym or come to any gym for that matter will attend classes and participate in programming on the FitTruck was really encouraging to me and very exciting because you know we have a healthcare crisis, and like food deserts, there are fitness deserts, and this solves that. So I'm just going to show you a quick video. It's only about a minute and a half, and it's just snippets from different types of workouts that we've done. I'll kind of pause it and chat through things so that I give you a little bit more description. So I'm going to go ahead and get started. So this is just some of the application. This is just kind of an overview of what is included on the truck. So you can see that everything stows inside of the truck, doors close down around it. It's able to be driven by anyone with a driver's license. It does not require a specialized CDL. The version that you see in the video is our largest version. It's called the 4.0. It gives you the ability to train up to 48 people on the truck. You could train more than that if you had stations off the truck, but that's just on the truck. We have a 3.0 and a 2.0 version, which if you're really interested to know what the differences are, I can get into that. And then this is going to cycle through just some of the different applications. So we work with a group here in Kansas City called Disabled But Not Really. So it's a group of adapted athletes. So these are folks who use different mobility devices, whether it's a wheelchair or cane or walker, or have some sort of physical disability that would keep them potentially from being inside of a gym, that are able to use the truck because it is so low entry and all of the accessories lower so low onto the ground. It's also what makes it really accessible for seniors, active older adults, and youth as well. So all of the equipment is designed to be outside. It's designed to allow for ease of movement, ease of setup, ease of breakdown, because in the gym business, you know, time is money. We knew that we needed to always ensure that one person can run the truck if it was a sole proprietor. So you could see here the ways in which we're able to make, so that was a really good example of how this is more accessible than in a gym. So this person who's using a wheelchair, he's able to access the cable cross by coming right up to the side of the truck. There's no stairs, there's no barrier of entry. He's not having to get through potentially a door that says it's ADA, but it's not ADA. And that's been this group's experience over and over again when they try to go to facilities. And so the other thing you could see here, this adapted athlete, we actually have a rower. So this person's sitting in their chair, and then we've put the rower on a step. And so they can actually use the rower without having to sit on the rower. So every single piece of equipment can be adapted for folks. And again, not just for adapted athletes, but for youth, for seniors, for active older adults. The other thing about this is the way in which hosting one of these workouts outside attracts community, right? So we're in parking lots of places that people frequent, and without fail, people walk up to us and say, "What is this? What is this thing?" It's got music, it's got lights. It feels exciting. It feels inviting. This is not boot camp out of the back of a trainer's car. I did that for many years in San Francisco. This is not schlepping dumbbells out into a park or using resistance bands. This is gym quality workout. So you're giving the highest level of care to the folks that you're trying to make an impact with. So the fact that you can barbell squat outside, you've got step and dip equipment on the back that you're seeing. This cable cross, I love. The cable cross is my favorite piece of equipment. That's Wesley Hamilton. He's the owner and founder of Disabled But Not Really. He's also was on Queer Eye, so he's kind of a celebrity, if you will. He is a huge fan of the FitTruck and a real advocate for what we're doing. So this product can be used a couple of ways. I shared that in the email that I sent to give you a little bit of scope. We can operate the truck in Kansas City, so we can go out and provide the programming and help with the event and, you know, kind of start to finish where we're the operator. But we can also get you to a place where you have a fully white label branded truck yourself, and then we can teach you how to be the operator so that you're not having to schedule through us. Now we put you in the position of owning the product and operating the product. It can be totally white labeled. I will say, because the outside of the box itself is flat, it is a mobile billboard. So every single time we go to an event, I'm getting messages in real time as we're driving to and from events, because people are we're on the street or we're outside, and people are sending me emails to the contact form or reaching out to us on social media. So it is truly so powerful, start to finish, from a marketing, kind of recruitment, retention standpoint, all the way through its medical and fitness health applications.
And you said you've Fort Worth YMCA has bought a couple of trucks.
That's right.
at this point, right?
So because I have sort of an insider relationship with some YMCAs, we went to a YMCA only trade show in March of this year. So the top 40 executives from across the country. So these are the biggest, most innovative YMCAs, C-suites were invited to this event. Only 20 vendors were invited, so it was a 2-to-1 ratio. And we spent a ton of time chatting with CEOs and talking about what are the problems that they're trying to solve at the YMCA. And then we offered them solutions based off of our product, but also just based off of our industry experience. So from there, we built relationships with YMCAs all across the country. So the first YMCA that we're going to place a truck in is the Fort Worth YMCA, Fort Worth Association. So they recently went through a reorganization with COVID. They were one of the only YMCAs that grew during COVID. The CEO there, Mike Brown, is incredibly innovative. He's very forward thinking. He's one of the top 5 CEOs in the country. We're going to place a truck there mid-November. They have applications. They're doing some really innovative things because of their reorg during COVID. A lot of smaller associations outside of the metro area were going to go away. So Fort Worth picked them up. So now they have branches that are as far as 30 miles away in rural Texas. So the CEO, Mike Brown, really has this idea that he can go and serve those communities with a fleet of trucks in a way that he couldn't serve them any other way, because running a facility is very expensive. Building a facility is very expensive. He could own 25 trucks for what he could fundraise for one YMCA. So they're going to use this for youth fitness. They're going to use it for active older adults. They're using it for their just adult fitness, fee-based adult fitness. They have a whole virtual membership, which is just a tier of membership. So it's virtual membership, and then any kind of offsite classes. They're going to add their fit truck to that tier of virtual membership. So he's got a ton of really cool, innovative things. They're actually going to partner with a local food bank to deliver food, because inside of the box of the truck is a fully equipped mobile office. So it's climate controlled. You could do health assessments. We have YMCAs that have talked about providing vaccinations to communities that will not come into the hospital or come into the YMCAs. The YMCA of Colorado Springs, they actually have a YMCA inside of a hospital there. That's how they intend to use their truck. So in all the ways the Y is collaborating with these other providers, and it sounds like that's exactly what you all are doing with this initiative. Fit Truck can help truly roll out those initiatives in a very strategic, very impactful, very efficient way.
Very cool. I think it's awesome.
Thank you.
You guys got any questions?
I did want to ask about pediatrics. So you mentioned kids a little bit, but in terms of training, kids you don't want just anybody doing
That's
that
right.
or offering
That's right. That's right.
classes or programs. So tell me a little bit about your options for kids.
Yeah, so if Fit Truck KC is the provider, like I said, I've owned a gym and been in the fitness industry for 20 plus years. I specialize in youth performance. So I have a ton of knowledge in how to load and train youth athletes. Josh, my business partner, does as well. If I were helping an organization, say Children's Mercy was like, hey, we really want to impact pediatric health, adolescent health, we could actually help create programming for you so that you could hire certified personal trainers who would then use our programming that was really sound, based in science, right? So we're making sure that it's safe. We're making sure that we're, taking things like growth plates and whatnot into consideration. So we could empower an organization to run these programs. Or if we're collaborating with a YMCA, I mean, the YMCA, that's what they do, right? So they specialize in youth fitness. So their staff is going to be trained to do that, so they could roll that application out for young people. The other thing that's really interesting about this is the application, because the biggest truck has 48, you could put 48 people on the truck. It's the same equipment from tip to tail. So you could run an adult fitness class and a youth fitness class at the same time. You would have different instructors and obviously very different programming, but that's always the issue whenever people are like, bring your kid to yoga or let's work out as a family. That's not real. That doesn't happen because people's fitness levels are so varied, or just their ability to access the equipment is so varied. But with this truck, that is actually possible, because you could set up a whole youth whole youth or pediatric side, and you could have adults working out on the other side. You could do the same for active older adults. So you could do senior fitness off of one side and adults off of the other side. So it truly makes it intergenerational. And in those communities where, an entire family are living together, grandparents, aunts and uncles, families, and doing it as a family and a community is vital because of childcare, for example, right? You don't have a place to take your kiddo, or childcare is not an option. You can bring them to be on the truck, and that retention rate goes way, way up, because now you can bring the senior parent, you can bring the youth person, and then within an hour time span, everyone's getting the opportunity to be impacted. So it really truly makes it intergenerational in that way. But we have all of the base knowledge to make it safe for young people.
Is your overarching goal for organizations to buy into the truck concept and purchase their own truck, and then they're going out and offering programming? Or
Yeah,
do you
so
also offer, you go to this location every Friday at 9 a.m. kind of a thing?
if you're in Kansas City, we're an operator in Kansas City. So either of those options work for us. We can either be the provider and the programmer and go out on location, and you can book us. That's absolutely an option. As we sell trucks to other organizations, we can refer health and other, healthcare and other organizations to providers in those areas, and they can do the same thing. I would think, oh, and we sell trucks. So we do both things. We do both the operation side and we do the sales side. I would think that it would take there'd be a little bit of a learning curve if, let's say, Children's Mercy is like, hey, we want to do this. I think you would allow us to run your programming for 6 months to a year. You start to get some metrics and some outcomes. And then you start to think about, does it make sense for us to bring this in-house? It could be significantly more flexible for you because you're not based off of our schedule, et cetera, et cetera. And also just from an impact standpoint, you could then create models of care that then you could share with other, healthcare systems across the country. So, but I would think, based off of what I know about what you're looking to do, you would allow us to run programming for a while and kind of see what works for you. But then I think an investment in a truck versus trying to create a brick and mortar facility that nobody's going to come into anyway would be the way forward.
But
Yeah,
at this
I
point,
mean, I
there's
see
not
this-
a way to, oh, sorry, Jay.
Go ahead.
There's not a way to, like, you have a family that comes in and you say, hey, this truck is going to be at this location convenient to you every week. That's not.
It could be. If you were to
But
contract with Fit Truck and say, hey, we want to make this truck accessible in these 5 locations across the city,
Yeah.
days and times are set, absolutely we could be there. And then
You're
you could
just not
share that
already
with
doing that.
Well, no, because it's based off of availability. So we're contracting out. We're not just going out and setting up on the street.
Yeah.
That wouldn't make sense for us as a business model. But if for example, you said we want you at so for example, we go out to Garmin on a regular basis. We do corporate wellness for them. They have a 35,000 square foot fitness facility, but we go out into the parking lot. They know the day and the time that we're going to be out there, and associates come out at that day and time. But they schedule with us, and we put that on kind of a big schedule. So we don't just go out on location randomly. We book ourselves for events, corporate partnerships, things like that. That makes much more sense from an operations standpoint than us just going out and saying like, hey, we're gonna do this thing. We have pop-up workouts sometimes where we'll say we're going to be at Loose Park, or we're going to be in a city gym parking lot. Come find us, and we advertise that through social media. But from a efficiency standpoint, I own a gym. I'm running Fit Truck full time. There's 2 employees with Fit Truck. I couldn't just go pop up someplace but like, for example, we are on a consistent basis the first Saturday of every month. We're at Ruby Jean's Juicery in the parking lot. So we're serving that community east of Troost with a trusted provider. Ruby Jean's is marketing it. We're marketing it, and we're out there consistently. But that's a partnership that we've created. So
Open to the public.
Open to the public. It's paid, but it's open to the public.
Yeah, that's more what I was thinking of versus like, I get the scheduling part, but at Garmin, it's for Garmin employees. And so if we're trying to find opportunities for people who live in the community to try out before you decide whether or not that's going to be a viable option. What does that look like? But that's an example of what you could do the first Saturdays, I think you said.
Absolutely. And we could work with you to talk about some communities that you want to make the most impact in, and create a schedule. And that could be underwritten by Children's Mercy, or just say to people, hey, it's $10 an hour, or what, I mean, however we felt like it made sense to price it. But it would be something that, it would be a kind of a co-effort in that way. But we have the flexibility to do that for sure.
Yeah, I see this, and I've already thought about this, and I'm going to talk with our sports medicine department, but I see this kind of 2 clear ways at Children's Mercy. One is a get people starting with physical fitness, and the other as a sports performance, physical therapy kind of piece. And one truck can do both things, which would be awesome.
Absolutely.
I mean, you could have it in, one location consistently for the sports performance stuff. You can have it, a kind of a traveling show of how to be physically fit the rest of the time. So
absolutely.
I mean, I think it's absolutely awesome. But
as a former professional athlete and someone who coached high level youth sports for a very long time, youth performance is a whole lane, right, in the fitness industry. And a lot of people get it really wrong, right? They don't program correctly. They don't understand youth bodies. They're doing too much. They just program for adults and kind of downsize it for young people. So having a provider that really understands performance, and then enhancing the programming that you're doing. So for example, let's say you're sporting soccer club. Now you don't have to build a strength and conditioning facility. You have a truck. So you have a staff person, a head, strength and conditioning coach. Maybe you have a few coaches that are running the programming for you. But every hour on the hour, you could be out at the Swope Park and run your youth teams through these trucks, instead of having to take parents to take them to a separate location, which is just not even going to happen, right? And then there are applications like we talked about, Dr. Roberson, on the weekend, where now you have your truck out and parents are there for 5 hours because they've got 2 or 3 kids, and parents could work out on the truck while their young person is playing, or in between games or whatever. So I mean, there are tons of applications from a youth sports side.
It's cool. I like the idea for sure.
I love it as well. I don't know if you're able in this early stage of discussion with this group about addressing cost, Haley. Are you able to give any kind of idea what this might cost?
Yeah, absolutely. Yeah. So it's very important to me to be transparent about our pricing. We do not have a ton of markups on these vehicles. We're very much interested in impact first. We know that if we have a replication of trucks across the country, then that profit eventually comes to us. So we're very transparent about cost. So for the largest vehicle, the 4.0, our starting cost is $360,000. That includes everything, all program supplies, all weight equipment, all audiovisual, The actual cab chassis itself, which right now those cab chassis are selling between 65 and 70, retailing for, and we're a used car dealer, so we get it at retail, about $60,000, $65,000. It includes, like I said, the office. It includes everything. So I say starting because there are those folks who want to upgrade the cab itself. They want upholstered seats, or they want a really amazing sound system inside of the cab. The sound system on the outside of the truck is actually Garmin audio marine grade equipment. So it's like really high end boat sound. And it is incredible. Everything is included in that $360,000. That's for the 4.0. For the 3.0, it starts at 300,000. The 2.0 is 250. As you move down, you lose features. For example, from the 4.0 to the 3.0, the office becomes an add-on cost, right? Once you move from the 3.0 to the 2.0, the door situation is slightly different. The size is smaller. So 4.0 is 48 people. The 3.0 is closer to 24, 26 people. That's the same size for the 2.0. But one of the things that I think makes it most cost efficient is that it does not require a CDL to drive it. We build it in such a way that anyone with a regular driver's license can drive it. We also equip it with 360-degree cameras. So it makes it very easy, user-friendly to drive. We use an Isuzu platform, which is a cab over platform, which means you sit really far forward in a cab. So it's very easy to drive. All of that, knowing we were going to be selling this to people who didn't have professional drivers, that they were going to be sending technicians, trainers, and instructors out to service communities, and that needed to not be a barrier. So again, 360, 300,000, 250.
What about the scenario of, let's say, a weekly on-site event? You mentioned Garmin does something like that. And without purchasing the truck. So if we had you guys come out somewhere once a week.
It depends on how far it is from the gym, how many instructors it requires. It's a little bit of a scale, but somewhere between $600 to $1,000 an hour. So that includes travel time, setup, instructors. But if you think about that, if let's say you're charging $25 a person, which is market rate for a fitness class in Kansas City, you cover that cost and then some. So that's one way to think of it. If it was a reoccurring class and we knew, hey, we've got this contract for 24 weeks. We actually run a class for a group of friends in the neighborhood out south. And so they book us for 18 weeks. We go Sunday at 5 p.m., rain or shine. And we give them a price break because of the consistency of the programming. So we can work with you and be flexible about pricing if it's a one-time event versus if it's a reoccurring event. But somewhere in the $600 to $800 range.
Thank you.
Yeah. Well, thank you so much for talking. I know you are tired and we want to let you get back to having your own vacation. So I don't want to keep you too much longer, but yeah, we recorded this, so we'll have it available for everybody, and I guess we can go back and reference it, and yeah, I'll be getting in contact with you for the other half of it, which is kind of sports medicine part of it.
You got it.
I've definitely got some ideas there for our program. So.
Well, I appreciate the opportunity to chat with you all. I am available for conversation. You have my email. Feel free to reach out to me anytime, even if you just want to brainstorm or say, hey, I thought of this application. Do you think it would work this way? I'm very excited about this product because as someone in the fitness industry who is doing it to impact public health and people's ability to fully enjoy their life, this is something I'm really passionate about. And so I think the healthcare sector is a really good fit for us. So I'm absolutely willing to donate my brain power to brainstorm with you or to come up with solutions and to be innovative in ways in which we can help solve some of your problems. So don't hesitate to reach out. And if you think you can use it in an application, you can. I haven't thought of a single application or heard of a single application that someone has said, could we do that? I say, no, probably not that. Every single time it's been, of course you could. So that's what's so exciting to me, because I do truly feel like it's a bridge that doesn't exist in the market. And I'm excited about the ways in which it can be utilized.
It's a cool
Awesome.
concept.
Thank
Thanks.
you.
Sure.
Thank you.
Thank you, Haley.
Have a great rest of your day.
You too.
Bye.
Bye-bye.
Thanks.
Safe travel.
Thank you.
Yeah, I think that's pretty cool. But I know we got a few other things to get to, so everyone can just percolate on that idea for sure. So I think we got updates for the Just Walk and the curriculum sectors. So you guys had the Just Walk meeting this morning. Sorry, I was in another meeting this morning. But what you guys
I
come up
I
with
can run you through
anything?
some quick updates with that.
Yeah,
Our
yeah.
Harris Park walk we're done with those for the year. We don't have any current plans to go back to Harris Park. If we do choose to go back there, what we'll ask is that we have a consistent group that has demonstrated an interest before we schedule those on a regular basis. Our last series of walks had one attendee over all the walks, so not quite the reach we had hoped or anticipated. We do have a walk going on at Mill Creek Streamway Park. This is in Johnson County. Those happen the second Saturday of the month. So this Saturday is our next walk. It's from 9:30 to 10:30. We have both an outdoor and an indoor location. So the plan is the walks occur outside on the path. But if we have inclement weather, we have made arrangements to go inside to a facility that's nearby and are partnering with Johnson County Parks and Rec to make all of that happen. They're helping us market those walks as well. We did get a number of people. We are offering a sign up. So for people who are interested in our walks, they can join our mailing list. We just send information about the walks. They don't have to register for the walk. They just show up. When you show up, we have you sign a waiver there. But other than that, it's really more informational. So again, those take place second Saturday of the month. We have our healthcare lead for this week talking about school anxiety. We have Helena LaRush, who is physician at Children's Mercy, who works in our weight management section. She will be leading November's walk. We're still waiting for a volunteer for December, and then we'll again start recruiting for next year. We are including med students at UMKC in our sign up to be volunteers at the walk. If we don't have a healthcare lead from UMKC joining them, we're not really comfortable supporting them providing the education, but certainly happy for them to be part of the walk and volunteering. Let's see, what else related to those walks? Oh, the other thing we're doing with that right now is we're dropping the children activities until we identify that there's a need for that. That's been a bit of a hiccup for us within the hospital setting. If we're managing kids, it has to be hospital employees who are managing kids, and it's really hard to find hospital volunteers to do that part. So we are pausing on that until we know there's a need. Once we know there's a need, we'll go back and revisit how we offer kids activities. But for right now, we're really sort of driving the adult piece. The other thing we've heard from multiple places, primarily from the Walk with a Doc program, AARP is really interested in supporting additional walk locations. KU Med had a group of students who were interested in taking the lead on bringing their walks back. We're hoping to connect them with AARP so that there's some additional support from a financial perspective to help get those walks started again. We also work with Stephanie Allison. She hosts walks at the Southeast Community Center. They're on the third Saturday of the month. We are purposely not doing them on the same Saturdays so as to ensure that our walks are taking place at multiple places across the city, but that we're also not interfering with other walks. So if someone happened to want to go to a walk every weekend, once they get into place, they could potentially do that. So we're trying to make sure as KU Med sets up their walks that they're picking the first or the fourth so that people have the opportunity to walk every Saturday somewhere if they wanted to.
Cool.
Any questions about that? Okay, that was a big update for that.
Yeah, that was the Just Walk update. The billing, I don't know if there's much of an update. Dave's not on today. I don't know how often they've actually ended up having meetings. I think they're waiting on some stuff, so.
Well, the only reminder is that we have some resources available to us related to billing and reimbursement from the American College of Lifestyle Medicine.
Mhm.
I also wanted to mention that the Physical Activity Alliance has as one of their initiatives, so that's the group that oversees the National Physical Activity Plan. They are heavily working on physical reimbursement for physical activity assessment and counseling. They are starting to have conversations at the federal level to ensure that these sorts of things are included, and then the codes are turned on so that reimbursement actually happens. We're trying to track on what they're doing, although it's hard to track on everything, but there is some movement on that nationally as well. That is one of the things that I hope to do. There are a couple of projects locally that are going on related to billing using devices, remote patient monitoring. They are research studies, so they're not really focused on the billing piece yet, but they have that as an intent once they identify that remote patient monitoring is useful, can be HIPAA compliant. Assessment and counseling can be done using them, and meaning you can download the data and track it and then eventually reimburse. What I need to do is get that group together to start talking about what they're learning through their different projects and what we know from the national standpoint to help support billing and reimbursement. You can bill if you don't get the money back for it, it doesn't matter.
Yeah, you can try.
Yeah.
It's worth a try. Awesome. And then the final thing is the curriculum group. As most people know, we had Dr. Trilk in town almost 2 months ago now. And she gave us lots of great information, lots of good resources, kind of wants to include us in some of the exercises, medicine, kind of implementation that they're doing, not so much in the schools, but on the actual patient level. And has given us a lot of resources for that. And we'd like to try to involve some of the primary care clinics and things like that around town to advance that where possible. So, we'd love any input and brainstorming anybody has about kind of implementing that within the actual hospital systems. Again, on the patient level. I think on the education level, we found out through that meeting with Dr. Trilk and meeting with everybody that we actually are doing a pretty decent job at both KU and UMKC. And then at Kansas City University, I think they're trying to get working on it, but I think curriculum stuff, we didn't have as many of the specific curriculum people involved in that meeting, so they might be, but we don't know for sure yet. But I think the other places are actually integrating it in little pieces, and we just want to continue that momentum. So those are kind of the two big things that came from her visit. And then Shelley's you got your four words, your 4 bullet points. He said to integrate. You go.
Yep. Integrate, which everyone is doing an outstanding job of within their settings and based on what they have going on with their processes to get that into curriculum. Student interest groups. So moving those forward is really valuable. We're really interested in hearing how, like at UMKC, I think they are setting up a culinary medicine interest group. KU Bend might be doing the same. We're really interested in hearing some of those, some of the learning that happens from the interest groups. The student self-assessment and self-care, that's another piece that was consistent across the board, how we can help. Well, how the groups can learn from each other about how those types of what self-assessments can be done that are realistic, and then how do you help the students follow up on that so they begin to understand their own behaviors and how hard it is to make a change, so that as they're working with patients, they understand that as well. And then the 4th thing was connection to community. So I Haley just mentioned this, you know, and really great. You can't just set something up and expect people to show up. Providing options in communities is really important, both from a social connectedness perspective, but an access standpoint as well. And so that's the last piece that I think was included in there.
Perfect. And then Joey Leitner, well, we for the funds, the implementation project funds, we use some for Dr. Trilk for her visit. Joey won his award from the Kansas City Physical Activity Plan funds. So I think he had I forgot how much money he
5,000. So
5,000. Okay.
he had asked for 500 per expert to a max of 10 experts to help
for some
inform
stipends.
curriculum. Yep.
Yes.
Curriculum
Oh,
development.
that's curriculum. Yeah, curriculum development, even in the healthcare setting, but also in the layperson setting. So kind of a global curriculum that can be broken apart and easily accessible in small chunks. It's a pretty cool idea. So they're working on that. And then so we got some extra funding. So if anybody's got any ideas that they want to get in before the end of the year and get some money for, there's money sitting there ready to be used. And I think if it's not used, then it goes back into the general Children's Mercy Philanthropy Fund or something. Okay, maybe I'm wrong.
No, thankfully ours.
That's
that
usually
doesn't
how
happen,
things
Chris.
go, but
Yeah.
okay.
I
No.
move that we buy a fit truck.
There you go. If it was $6,000, I would put that in
That's right. We'd be in. Heck yeah.
But maybe we could start a project where we could get them coming for 10 Saturdays somewhere or something like that. That might be something worth looking into and seeing how it starts.
I'm glad
Kind
you
of a
mentioned that because
pilot project.
and there are a couple of ways to consider it. One would be having this align with the Just Walk. So instead of having to go on a
Yeah.
walk, you could do a workout instead, but it's still on the same day, same time.
Just
sort of
walk
that
or just
consistency.
work out.
There you go. And introduces people to a different form of working out.
Yeah.
You could
Yeah.
also do it as, so an idea is with the KCU's CHAMPS program. So CHAMPS is after they do their school assessments, their youth health assessments in schools, they identify those that are at either have a chronic disease or at risk. So overweight or obese, might have high blood pressure or something else that would indicate a chronic condition. They have an 8-week program that those letter goes home to the parents. The parents can choose to participate in CHAMPS. CHAMPS is was an 8-week program. A medical student would meet with the family, talk about healthy lifestyle behaviors, help them engage in behavior change. Fit Truck could be a component of that, sort of like exercise is medicine, but in a group setting. So for all the kids who participate in the CHAMPS project, you could have once a week, here's your physical activity. We're doing it together. You go home and do it on your own other days. And then afterwards, we want you to find another place to do these sorts of things, or you come up with your plan at the end of that. I don't know. But when we talk about pilot projects, that's certainly a potential idea to consider. And then pulling in Parks and Recreation as well. So if you pull Parks and Recreation in, you have the ability to apply for their funds as well. And maybe that class occurs in a park setting so that a community is introduced to the park setting, the facilities there, a community center that might be there as well, so that you can engage in these same behaviors after your program might be over. But it gives you some learning that can be done with a potential pilot project.
Yeah, I like it.
And Shelley, you
So we
mentioned
Read something.
parks. I just actually ran into Heath out at Lee Summit Parks yesterday, I think. They've got great facilities, but they've got a whole lot more parks than they have facilities. And,
Yeah.
might they be able to incorporate this Fit Truck in some of their park locations on certain days? Will Haley be making a presentation to the parks sector possibly?
She said she would be happy to talk to whichever sector that wants her to talk. She's
Okay.
all about getting the word out more. So yeah, we could definitely do that.
Well, and Katie,
I
who
gotta
supports
go.
the healthcare sector. Yeah, Jay, we'll wrap it up for you.
Sorry, yeah, okay.
Thanks, Jay.
Katie, who supports
Jay.
this sector, also supports Parks and Rec, so we can work on that to try to make that happen.
Great.
But I love the idea, Ed, of what Haley was talking about. So at Ruby Jean's first Saturday of the month, they're always doing
Oh, yeah.
Fit Truck in the community. I love the idea of trialing that somewhere. And that, you know, like,
Yeah.
for example, it's healthcare sector or it's KCPA funds that help support the initiation of that with the transition over to a park and recreation facility. And they decide how they pay for it and how they charge people to participate. But the biggest barrier to a lot of these things is getting the word out and getting it started.
Yeah.
Once you get it started and people understand this is a routine now, then okay, and it's fun and they got to figure that out without spending a bunch of money. Now you have a chance.
Well, and you mentioned, maybe partnering with ourselves on the Just Walk program. I mean, I could totally see some people who don't go to Just Walk because, they've got their kids or their grandkids or whatever, and I could also see the kids or grandkids getting all excited about hanging out around the Fit Truck while mom or dad or grandpa and grandpa are out, walking, or some combination.
Yeah.
I could really see some options there for integrating those.
Yeah. Well, keep thinking about it and we
Sure.
have a lot, quite a bit of, when I say quite a bit, we don't have $360,000 worth of funds to be able to do this, but we do have, I'm going to say $40,000 to $50,000 across sectors that have the group each group wanted to get around a concept and have the ability to provide thoughts on what we would do and what we would learn from that in order to improve sustainability, then, that's a decent amount of money to try some of these things to see what would work.
Absolutely. Well, thanks, you guys.
Mull it over. Great to see you.
Okay. Good to see you all.
Hey, last thing I do want to mention, but G already knows this. We have invited Shannon Worthman, who is the Director of Education with the American College of Lifestyle Medicine, to come to our next meeting in November. She's going to be joining us to share more about the resources that are available to us. And these are resources that are available at no cost.
Those are good resources.
Say that again. It's the curriculum meeting? Oh, sorry.
It's the curriculum meeting, yeah. So,
Okay,
and the
thanks.
curriculum one is November 7th.
At 11.
Mhm.
And Ed, I think you came to the last one of those, but that's going to be, we want to promote that as well.
Good deal. Well,
Okay.
thanks, you guys.
Yeah, you bet.
Enjoy the fall weather out there.
Will do. You do the same. Have a great rest of your week.
You too. Take care.